So today we are going to be, like Tina said, going over the Marketing Cloud use cases. But we wanted to go ahead and start with a general overview of the healthcare user group and what we are. So we're a group intended to be focused on Salesforce and the healthcare industry, but we welcome everyone, who's kind of included or around the work that we do. And we're focused on our virtual meetings. We also have a presence in the Salesforce success community. So there is a community group that we work with and manage, and Tina pays heavy attention to. And then our meetings are recorded and posted to YouTube as well.
Did I skip? I did. There we go.
So introductions, we have Tina and myself. Tina, do you want to go ahead and?
Sure. So hi, it's Tina Woodall. I think there's several of you here that are new to me. Pleasure to meet you all and good to see those who are returning. I have 16 plus years in healthcare IT. A lot of it is population health, discharge planning, and home health experience. And I am now a mad and passionate Salesforce nerd, and just like to joke around. I love Salesforce, even though sometimes in my Salesforce Kool-Aid, I need to add alcohol. And we're working with it. And my fun fact for me is, we like to do fun facts, is that we love theme parks in my family, but 4 roller coasters in a row is my limit, as I tell my teenage son. Corinne?
I feel like that's reasonable.
We bow down to you.
My name is Corinne. I am a HLS focused Salesforce consultant. I've been in the industry for over 12 years now. And my fun fact is, well, I should change it. It's not super new anymore, but I am in my first All Rogues D&D campaign, which has been really fun.
And today we have guests, our special guest.
We do. Our first guest is CJ. I don't know if he's available and wants to.
He's there. CJ and Jordan right here.
Yep, I can jump in and just give a quick introduction. So pleasure to meet everybody. My name's CJ. I am, as you can see, a lead solution engineer at what I like to call the Mecca at Salesforce itself. And I've been working with Salesforce for about almost 9 years now, specifically more focused on the marketing solutions end of things. I actually worked on more of the services end at Salesforce and the financial services sector actually for a while, and then actually left, went to WeWork, which I swear a couple years ago sounded much cooler than it does now, but went and did that and implemented Marketing Cloud there. Then left and was able to thankfully meet someone like Tina here, who is our lovely head of the user group, and got to work with her at Coastal Cloud in the partner space before the pull of Salesforce brought me back, just like a tractor beam in Star Trek, and it pulled me back last fall, and I am now working more so on the pre-sales end of things at Salesforce. But been working, with healthcare companies, and specifically my focus at Salesforce is helping design marketing solutions around more of our life sciences and our med device space. So pharmaceuticals, and as I mentioned, like the medical device area. So, and then just quickly, a little bit about me. You already see that on the screen. The fun fact is I'm obsessed with, don't have it on here, I'm obsessed with sharks, but I'm also love llamas, and thankfully I've been to 3 different countries to be able to see them, and went to Peru, saw Machu Picchu, but you'll see the most pictures in my photo album are not from that, but it's from the llama farm that I got to go to and feed them. So I think the llamas are the coolest, and yeah, looking forward to getting to meet you guys and talk through today's content.
Is there a Trailblazer llama sticker or character? Isn't there one?
There should be.
There should be, right?
I don't think there is, but that is a great point. There should be a petition to get a llama, because llamas have the greatest facial expressions of any animal. They are, they're super boss. So anyways, Jordan, I'll kick it over to you.
Absolutely. Don't know how I'm supposed to follow up CJ. It's quite an impressive resume, but I'm Jordan Seeley. I've been working in the Salesforce space for the last 6 years. I originally got my start in the core CRM side of the equation, so sales, service, communities, things of that nature. And about 3 years ago, I started working almost exclusively with Marketing Cloud and different marketing products within the marketing suite of products at Salesforce. Some non-Salesforce products as well, but generally speaking, the focus has been MarTech within the context of the products that Salesforce sells. Over the course of time, I've been primarily focused in healthcare organizations. My background is in biomedical engineering, and just by nature of that background and some of the exposure to the industry that I've had, I've continued that focus. But I've also worked with financial services companies as well as high-tech companies. But I think the bread and butter for a lot of the use cases that we're going to talk about today really falls squarely within the context of a patient journey or patient health, and really improving those outcomes for different patients throughout the context of their interactions with different organizations. I'll leave it with that, aside from the fun fact that I have jumped out of a plane twice on the same day. Basically, I bought the recording service where they take a picture or take a video. And when we went, they accidentally recorded my brother instead of me. My brother didn't originally want it. So they gave me the option of either jumping again and they would record it, or to just get a refund. And I said, you know what, we already paid for it. Let's go for it. Second plane was a lot smaller and a lot more rickety. So it was more of an adventure. Don't want to say I regret it, but I don't know if I would do it again, but it was a lot of fun. So with that, I'll turn it back over to Tina.
Thank you. Corinne, do you want to go over the ground rules, or you want me to do that?
Either way, I'm happy to get it started. So since we do have a much larger group today, we want to make sure that we're following the general ground rules for Zoom calls. We want to be sure to leverage the chat feature. If you do want to, pop in and ask your question verbally, please raise your hand first, and we'll be moderating the chat and participation features. And then we will be ending the meeting on time, and we'll be posting the recording. So if there's any additional questions that you may have that we aren't able to get to, please leverage the Trailblazer community that we mentioned earlier in the call. And we'll have a link to that as well.
Awesome. Thank you, Corinne. So why we're here today, Marketing Cloud for patient engagement. Let's set the stage. This is our use cases, our goals, our requirements. We want to set the stage and set what we're going to be looking at and doing, because the focus is on Marketing Cloud, but Marketing Cloud is going to be fed from the Health Cloud. So our goal is reduce hospital readmissions for at-risk patients. This is either from a payer or a hospital system, because a payer could want to reduce the hospital readmissions for their at-risk patients, i.e. reduce their expenses, or it could be actual a hospital system which could get fined on readmissions. So the goal is for that, but it could be either type of clients. The requirement is for a defined patient population discharged from the acute setting, the hospital setting, automatically trigger customized text follow-up within 24 to 72 hours post-discharge. Score the results of the interaction within Health Cloud and trigger alerting based on the score responses to the interaction. So based upon the responses of the interaction, act appropriately, and then store the results of the interaction within Health Cloud. In addition, we want to be careful. We want to box this with assumptions. Assumptions are the patient demographics are in Health Cloud. So Sally, the patient, her phone, address, email, and so forth is in Health Cloud. The encounter data is either populated in Health Cloud, which you can through the Health Cloud data model, populate encounters, or you may have it in a separate data lake, but it has to be easily accessible to the Marketing Cloud. Consent has been obtained for the texting or email for the patient and is stored in Health Cloud, or if not stored, it's implied consent and you have tracked opt-out. And Population Health has already identified the patient in Health Cloud for at-risk disease management. And this is really, really critical for this assumption, is that a little unknown gotcha if you haven't worked in healthcare. Sally goes into the hospital. Her admitting diagnosis is usually, in my experience, and it might be different in other healthcare systems, but the ones I've been experiencing is that the admitting diagnosis is a freeform text box you type in, they present it with chest pains. When Sally is discharged, all that information from her stay is then compiled and reviewed, and then a official discharge diagnosis code is added. And that can be 1 to 2 weeks post-discharge because that's related to billing. So if Sally is brand new and there's no population health identifier on her, you cannot respond appropriately if you're trying to focus in on a population. So this is really important for these assumptions of what we're walking into on this. Is there any other items that people would like to consider? Because we're going to now pivot into my favorite tool that was provided to me by Slalom. Slalom introduced me to this and I love this. But is there any other requirements that people would like us to consider before we jump in to our designing based around our use case? One of them, I think Jordan called out, do we want to look at personalization of the text messaging? Different healthcare clients, you know, some of them say, no, we don't want to personalize. We don't want that text. Someone else pick up that text and it says so-and-so name, or they have some personalization on it. They don't want it. They want it to be more anonymous. You have to take in the legal team review. So is there any request on, we'd like to see a personalization part of that? Jordan, what are your thoughts were you having on that? Because for this part.
Well, I think that from an approach, we can probably start without personalization, and then we can talk about some of the mechanisms to introduce personalization for teams and organizations that are fine with that risk appetite, or whatever risk appetite they might have. So we can probably go without personalization to start, and then just speak to how we would incorporate that if we wanted to.
However you want to do it. At this point, I'm handing this off to you and CJ. So here is the Health Cloud. We have in here Health Cloud. We're using cases with a care plan. Care plan in this scenario is calling out what is the patient population. Custom object is for storing the responses from Marketing Cloud. And in this diagram, in this use case, the encounters are stored outside of Health Cloud. For the patient profile that we're looking at for your use case, the population healthcare plan is the COPD, is chronic obstructive pulmonary disease. For those of you who are not aware, it's basically progressive damage to the airways for the lungs. Payer, Medicare, Medicaid, male, age 65, recent encounter, admitted as inpatient. CJ, don't highlight it while I'm reading it.
I was just going to edit the spelling there for payer.
Please correct my spelling on that. And then recent encounter, that was one of my things. I was looking at this going, did I have anything misspelled? Recent encounter admitted as inpatient, which is important because they could go to the ER and only be outpatient, not as inpatient, different reimbursement ratios. Length of hospital stay is greater than 3 days, and time since last encounter, whether inpatient or outpatient, is less than 30 days. This is a very real type of scenario that you could be encountering.
Tina, would we ever include any social determinants?
Hey, Marlene, we really need you, please, if you could put in questions in chat, and we definitely would love to respond or raise your hand because we have a lot of people on this call. So great. Nope, no problem. Yeah, if you could do that, would be awesome. But to answer that, moving forward, please, through the chat or raising the hand. But yes, social determinants. There's that's you're implying if social determinants are on there that you have active care management already with that patient. This is a mass volume type of scenario where you've tagged them from a prior admission by a official discharge diagnosis code, and then you can tag them and a much higher, think bigger volumes, managing big volumes of patients. Social determinants, you're looking at probably a little bit more personalization once you've identified your patient population. Possibly, you could look at others. And then the other component in this is our messaging stream, which first message, do you need assistance with prescriptions being filled? If they do, the question is, does someone need to contact you? 2, follow up with the physician appointment scheduled? Yes, no, no, do you need assistance? And 3, are you feeling better? Guys, I'm horrible at surveys. This is off the top of my head like last night. Please feel free to, in your own heads, don't need to share how this could have been phrased better. But are you feeling better? Yes or no? And then no, do you want someone to contact you? All right, wizards, CJ, Jordan.
All right. Well, I think that where we can probably start, and CJ, feel free to add in if you want to go a different direction on this, but knowing that we have this profile for the patient that we want to include in the Marketing Cloud journey, what that typically starts with is we know these segmentation criteria and we need to decide on how we're going to get them into that journey. So if you're familiar with Marketing Cloud, there's a couple of different ways that you can actually do that. I would say the most common is the data extension, which is effectively just a table. There's also things like the Sales Cloud data or Service Cloud data if you wanted to reference data directly in Service Cloud. There's some limitations here and there. So for this exercise, I think we'll start with the data extension approach. And the reason why I think we can start there is we know that there's multiple objects that we need to evaluate for criteria. So looking at our patient profile, we know that first we have male age 65 for the patient profile for this journey. So we need some demographic data. And I think we're going to make the assumption that that's either going to be on the contact record or it can be one of the Health Cloud specific records and objects like EMR patient, but we need some patient demographic information of which age is going to be one. The best way to do this, I think, I'm just going to make the assumption if someone has a strong opinion on using EMR patient, let me know, but I'm just going to make the assumption that contact for now. And we'll say we want from the contact object, we want the age attribute. From looking at our other segmentation criteria, we have payer, Medicare, or Medicaid. So let's make the assumption that we have the payer object. We'll use our trusty ER spelling for this one. And then our segmentation.
Jordan, hold up 1 second. I want to zoom in. So should I move this over so I can zoom in so people can have it easier to read, or what would you recommend?
I think that works. Yeah, if you can move that over to the left, we'll treat that
Sure.
just like as the segmentation criteria, and we'll kind of move left to right, like the Canvas activities within Marketing Cloud.
Yeah, and Jordan, I don't want to derail what we're putting in here in terms of the attributes, but one thing I do want to mention is in terms of the entry source, if we're treating this as a follow-up after essentially an event after they've been discharged, it may potentially make sense if you're recording. So a couple of things. One of the things you can do within Journey Builder, if anybody's not familiar, is that you can use a API event, for example. So if let's say you're recording that data when somebody does leave or actually has that event happen, you just have that call over to Marketing Cloud and enter them in that way. But one thing I was thinking of, Jordan, was because it's a event that we want to make sure we automatically trigger or follow up on, may make sense if you're recording that data or that object or that record gets created in Health Cloud when that event happens, to use a Salesforce entry event here.
Okay, and would you want to do that off the encounter object then? And then we would grab attributes based off of the relationships between those objects? You
got it, yeah. So once a encounter record would be created, you just use that as the object to trigger the journey. So record gets created, Marketing Cloud then triggers the patient into that journey, and then we can start pulling in the related attribute information that we need through there.
Okay, perfect. Yeah, there's multiple ways to do this, and I think that's a perfectly valid one. So let's take that approach off the encounter object. And then just to confirm, do you see any use cases where we would actually want to include created or updated, or you think created is probably fine? I'm imagining created is fine.
Yeah, I think for this use case, created is totally fine, right? I think if there were information that you were, if there's a process within this given account where maybe the record gets created right away, right? But the information has to wait to actually get updated and it's not asynchronous, then we could do a created and updated. But I think in this, to keep it simple, we just say that once that encounter record is created, it has the information that we need, so we can just use created.
Okay, perfect. I'm just filling in some of these additional details from up above. Just some comments to call out. Depending on how you're structuring age information, maybe you have a birth date field, which is going to give you a actual date value. You might have to calculate a specific age to say they're over 65, versus if you have a formula field that is already calculating what their age is in number, then you would be able to say, 65 or greater. So just a couple of call outs there. Other flavors of how you can do segmentation criteria. And then let's just make the assumption that length of stay equals 3+. Making sure we have the rest of our segmentation criteria. and healthcare plan COPD. Time since last encounter, we might need to solve for that a couple of different ways to suppress someone. Let's come back to that though. So this will ultimately end up being our segmentation criteria, which the operation is created, and we said Salesforce data entry source. And basically what it's saying, anybody that meets this criteria, we are going to enter them into this journey with the goal of reducing hospital readmissions for at-risk patients. And we have identified the first three modify based off of if we want to change the messaging, but we know that we want to send roughly 3 SMS messages in the first 24 hours, and then use some of the outputs from those interactions to maybe dictate ways that we should push a patient down different subpaths, or maybe not at all. So we can start laying the foundation for what this will look like in journey format. And I've created just a copy of sticky notes for different Canvas activities. We know we're going to need 3 of these ones. And if there are additional comments or questions or suggestions that we'd like to incorporate to this, feel free to drop those in the comments too. And we can say, hey, I'd rather do 4 SMS messages. I think that this particular SMS message is important. So feel free to drop that into the comments, and then we can incorporate that feedback live. And then Miro is limiting me. Here we go. All right, so first SMS message is, I'm going to ask a question of the team. How often do we want to wait before we send this first SMS message, this need assistance with prescriptions? Do we want to wait at all after this record is created? Or do we think that we're fine as soon as that encounter is created in Health Cloud, we're fine sending that message? Any opinions or thoughts, preferences?
Based on this population being Medicare, Medicaid, the assumption is that the socioeconomic is lower. So just by, you can imply or infer that they may need financial assistance to fill that. So there may not be a time factor, and also with the nature of this. So you actually don't want to delay, but this is implied. That's where I'm going with on that one.
Perfect. Yeah, I think that makes a lot of sense. We can leave commentary. I was going to just make a note of like why we're making that decision, but I think that we're fine here. So SMS number 1. And then I'm just going to copy the other. Oh, they're all grouped. Give me a second here. Well, it doesn't like them not being grouped.
Oh, do you need, I think I grouped them together. Here, you want me to do it real quick?
That would be great. Sorry, I was having
No.
difficulty.
Yeah, you should be able to grab them now. Yep.
Perfect.
Just delete that. And don't worry about annotation. I think I could speak for the group and say we're just more curious of how you and CJ would design this. Really?
Sure.
Yeah.
I'm just gonna replace these together, and then we can color code them later.
No
So
worries.
no time delay on that. We'll go first to this text message. And then one thing that we might want to consider too, especially in the context of if they're Medicare, Medicaid, and they might have lower accessibility, maybe they don't have a phone or they don't have a channel. So we might actually want to check for other channels that exist too, such as email. If that's something that we want to entertain, then we can. I would probably create like a decision split here that's referencing other channels that they have, just as a way to explore other ways that we can connect with them. But let's make the assumption that we are going to go with just text message for now. And then from here, usually what we'll do is we'll use something like either an engagement split or even a weight split to see if the intended action that we're trying to get, or a action that we're trying to get, has happened. What we might want to do here is wait whatever we want to designate as a reasonable amount of time for a text to come back in. So let's say we say that's what, 6 hours, 10 hours?
Yeah, so there's actually, I'm glad you got to this point, Jordan, because there's a couple of ways we could solution this. And so one is, and I think as you are kind of outlining here, is like the wait by duration, probably the simplest and easiest way to be able to format that. So you, as you said, you wait like 6 hours and then check to see if there's a response. And then, you know, based on that response, which I think you're about to get to, which is put like a decision split right after this, then we can send the message. But one thing that we also have, or that we could use, is we do have a two other ways we could kind of handle for this. One is that you have a wait until event activity, which is fairly new. If anybody's not familiar within Journey Builder, you can use essentially a API call that's made. So once somebody texts, or if the goal is to click a link, you can actually make a call and then trigger that to go down. I think in this case, probably doesn't make sense to use that, given that we're just waiting for a response, but you can set up autoresponder type of text messages, which actually brings up a good question, I think, for us to think about is, do we need a full journey to potentially, if we want to do that in a more automated way? And what I mean by is, you send that first text, they respond. In Mobile Connect, you can set up those autoresponder messages. So once they respond, then you can be able to send out the next message.
Yeah, completely viable path that we could do too. And I'm glad you called out the wait until event. I remember seeing that recently in one of the releases, and it's certainly something that I've been waiting for I want to say like 2 years.
I've been waiting for it since like exact target days. Yep.
Yeah, very similar to the concept of like goals or exit criteria. Usually exit criteria, you'll want to be able to, as soon as that exit criteria is met, maybe that's an event, you'll want to trigger that. So,
yep. And one thing I'll mention too, just from the Salesforce side of things, you know, we are, so obviously safe harbor at standard Salesforce, but we are working on ways to, so for instance, there is a new release. I don't know if anybody is familiar with the August release, but in terms of an event happening within like mobile push. So let's say there's an app and you have like a app for a given, let's like, for instance, I have a NYU like hospitals app, and maybe I have some sort of event where I'm reporting something in that app. You can actually trigger a message based on that event through Journey Builder. So there's a wait until mobile push event. And I do know that that's something on SMS wise, they are, I think, looking into more for the product type of roadmap. So more to come per se on the wait. I think what we can do here though, Jordan, is probably, we'll just keep the wait by duration to keep it a little simpler. But yeah, lots of options, and I think more exciting things coming with the wait activities within Journey Builder.
Absolutely. It's the beautiful thing about solutioning is there's at least a dozen ways that you can build something. So, all right. While you're going through some of that, I was just trying to lay some of the additional foundation for what this journey might look like. So if we do go that wait by duration, we're going to give this patient about 6 hours to understand, you know, if they've actually responded or not, give them a chance to respond, and then use whatever their response or non-response is to dictate what should happen next. So we're going to accommodate a couple of different subpaths here, because we know that the response can either be yes, no, or maybe something else. We know it's at least yes or no. So let's say that we've waited 6 hours. We have a decision split, and we've identified that the patient has responded. Let's also assume that they do want help. So maybe this triggers a follow-up that says, hey, please call this number to receive help with your subscriptions. That might be a specific plan or a specific call center that can help patients after they've gone through discharge. And then for instances where that's not happening, let's say that the patient hasn't responded, or maybe they've responded no, something of that nature. We know that one of our follow-up text messages is that not only do we want to check and make sure if they need help for the prescriptions being filled, but we also want to check if they need or if they have a follow-up appointment scheduled. So if they've responded, let's do this actually. We're going to make a live edit. They've responded, yes, needs help. And this is perfect for some of those keywords that might come up in Mobile Studio. Let's do yes, does not need help. And then we'd probably want a path that says, no, they haven't responded. We might want to send another version of this first message that might resonate better with them, or ask a different type of question that's related to our first goal of getting those prescriptions filled. But let's say this person does not need help. Maybe the next logical flow is, all right, if you don't need help with your prescriptions being filled, let's check and make sure that the second goal of having that follow-up appointment is scheduled. So yes does not need help, rather, does not help. And then from here, generally what I've seen is, for sake of consistency and ease, you might actually copy some of these activities, whether on the Canvas or you can recreate them, but there is a tool where you can select Canvas activities in Marketing Cloud, copy them as a group, and then just drop them back within the journey. Super, super helpful. If you have journeys that have, let's say, 10 to 20 different activities that you need to copy across different subpaths, I've seen it happen, but just a little tip there. We'll say for our second text, we'll just follow the same pattern unless we want to change it up, but we'll give them another 6 hours to respond to that text. If they haven't, we will also accommodate a variety of responses and make sure that we're following up within 24 hours for those first 3 texts that we wanted to send after discharge. So maybe for this one, follow-up appointment scheduled, yes, no. Let's say yes, it's scheduled. Anyone from the audience, CJ, Tina, what should the message be if they've responded yes, that they have their appointment scheduled as a follow-up? Any thoughts?
I was actually looking for my raise the hand, but since apparently I'm sharing my screen, I can't raise my hand. They assume I can speak.
Oh, no.
So I was like, going to be all courteous and follow my own rules. And I'm like, I can't even do that. So Marlene's like, I'm raising my hand, but it would just move great. It's just more of an affirmation. Go ahead, Marlene.
I was actually going to type that, say, great, thanks. Would you like to schedule that appointment now or call someone to schedule that appointment?
Oh, no, it has been. I'm sorry, Jordan. Was that yes, appointment is scheduled? Or yeah, so yes, you're one step ahead. It's perfect. It's affirmation. One thing I do want to talk about, though, is in this process, how do you ever deal with loops? So one of those things that, we always want to say, if this is a medical emergency, dial 911. Have you ever run into situations, Jordan or CJ, where you're actually designing these, you're interacting, you're following up with patients, you want to remind them, like if they all of a sudden hit 911 or I'm in distress, how do you opt out? Because you always want to make sure, the disclaimer, this isn't, every time you call a healthcare system, they're always like, if this is an emergency, hang up and dial 911.
Yeah, I think so. A couple topics to unpack there. I think that for the large majority, if there's like a stop keyword, which is what is typically used for Mobile Connect in Marketing Cloud, that'll automatically trigger a subset of responses in a conversation. So that's like effectively an opt-out. For maybe the first conversation, you might want to send 2 texts. That's a potential thing. So what we could do, if we wanted to use this as a way to solve that problem, is not only do we send them that first message, but the first message we actually send is, if this is a medical emergency, please call 911, and then send a follow-up text, assuming we have our assumption of opt-in consent. But we can just set that as the first step in the interaction if we wanted to. Does that sound like that would fulfill the requirement? Other thoughts?
I think so, but yes, a little nuancing, but absolutely. So for the audience, if you're not familiar, the first 72 hours is a high risk time frame for readmission. So depending upon your different patient populations, for that reach out and engagement, if all of a sudden you're concerned that they may be more frail or maybe doing that, that's a different layer, right? And that's the beauty of having a very targeted population that you're dealing with. You can have very targeted messaging of, do you need to first do a pulse check? Are you okay? Or are you in distress? And then how do you handle that? Right. So that's just my only concern is if you reach out and they're in distress,
sure.
And how would you like nip that in the bud versus them saying, I answered this text.
That is true. What if we played with the idea of replacing, and if there's other questions or thoughts on it, we could play with the idea of starting off the interaction with saying, how are you feeling? Are you feeling better? Yes, no. And if they're not feeling better, we can probe and say, how can we help, right? Is there assistance that we can provide with medication? Is there assistance that we can provide with scheduling your next follow-up appointment if that hasn't already been done? But we could flip the script. Instead of saying this is the third message in our series, we could actually start with that if we think that'll provide a better patient experience.
Yeah, I think one other, yeah, and that was the route I was going to go down as well, Jordan. One thing I'll mention too, by the way, that I think is important, and I'm glad you talked about the stop keyword. There are other keyword, you can define as many stop keywords as you want. So if you say, you know, have a specific keyword defined, maybe not like 911 as the keyword, but if you have a keyword defined where somebody does send that in and it's an emergency, like essentially if you even have that as a keyword, or, you know, they text back emergency, you can essentially use that as a stop keyword as well. So you don't always have to have it as stop. You can define whatever you want for those keywords too. But to your point, Jordan, I think having that active or that message first, just to see if they're feeling better, that allows you to not only put them down a different path if they say no, but then also we can kind of, you know, send that next message, and then if there is no response to that, potentially just leave it at that within the journey. And you can also use, for instance, like an update contact activity to basically flag them and say, maybe we don't want to opt them out of communications, but we want to like put it's almost like a temporary opt out that you want to be able to use, which you can use within other journeys then to say, hey, if they have even just like a temp op that is, you know, recorded, or you're waiting until that data gets updated in Salesforce, you can use that as well. So that's another way to kind of address this scenario.
Sure. I'm going to break our rule or our earlier agreement, and I actually am going to include a wait until event activity here. And we'll just say that we're going to start with this interaction by asking, are you feeling better? Yes or no? And the event that we're going to wait for is a response to that specific message. And then what we can do here, a couple of different ways that we can proceed is, if we know that that response is no and that it's been received, we don't actually have to include, you know, the wait by duration, et cetera, because we just want a response. But if we know that that's no, let's include some message around, if this is an emergency, you're not feeling better, please call 911. And that can set the tone for the rest of the interaction. But if we know that they are feeling better, what we can potentially do, a number of different ways to do it, common theme throughout the entire conversation, is we can actually do a join activity. And if you're not familiar with a join activity, effectively that allows you to take other subpaths and combine them if and where it makes sense. And so the context here is that if I know that they're feeling better, and I will defer to anyone that would want to make the argument that we would always want to send this message regardless, but maybe if we're feeling better and we have the appetite for it, we actually just join them back up and only send them the next message of, that's great to hear, you know, do you need assistance with your prescription? But we have some additional tools based off of the response that we're getting to help dictate and personalize a lot of these interactions, however we'd really like to. So does this feel okay? Any questions or comments on this? And then anything that we've received from feedback in the comment section that we wanted to pull up right now? Are we getting what we want out of the session? Can we get feedback on that? Is there other areas that we wanted to focus on as well? I know that we're about 40 minutes in, so I just want to time check.
Well, I'm also going to pivot us here shortly. You know, this group is making us a liar. Corinne, usually we have a much more vocal group, and you all are being quiet. We told CJ and Jordan, you guys were much more active. Any other follow-ups or questions? I think everyone's absorbing. we're pouring a lot of information down right now.
And I know for me that Marketing Cloud is definitely a big gap in my knowledge. This is like the platform that I know the least about. So I've just been sitting and listening. It's really great information. But Marlene,
Marlene, I thought you had forgotten to lower your hand from the first comment when you raised your hand.
I know, right? I gotta get it right. I'm off.
Marlene.
No, I'm kind of like Corinne in the sense where I have a little gap back towards Marketing Cloud, but I obviously see the benefit on the front end, and the join feature that Jordan was just saying. I'm lean towards initially that skip that first question and go a little more precise, or more specific to, okay, that sounds great. And then give like one or two suggestions on, well, everything's great. How about, do you need help with that prescription? And kind of lead them down a path. Or if they then say, no, and then they get wordy, then we can react based on some keywords from there. That's where you can sub.
Jordan, do you think it'd be helpful to show real quick just an example of what this could look like within Journey Builder and what that would look like on the canvas? We can come back to this, but I actually have it on my side screen here that I can go through and just kind of give an example. So again, if you're familiar with Journey Builder, great. This is all going to look very similar to you, but if not, this might actually be a good visual to look at here. So let me just.
And while you're doing that, also to follow up really quickly is for those of you on the phone, and also when looking at this, working closely with your clinical team is vital. The clinical team really is going to be able to give you that nuancing and what is really appropriate for that patient population and how to respond. So before you get too far down that rabbit hole, you really, really, really need to get them to give you that direction. This is a partnership with the clinical and the technical. This is not something done separate from them.
Yeah, the most important piece of any solution you're building, whether it be Marketing Cloud or Salesforce, is discovery. If you don't have the outline or requirements with either of those teams, especially Tina, I know you had brought up like the HIPAA compliance piece. You know, every team, every organization, especially in healthcare, they're going to have different levels of comfort and what they are willing to store and be able to use within these types of campaigns or journeys. So you guys can see my screen here, right? Within Journey Builder. So we'll put this here as just a readmission.
And I am at 10 till. I'm going to want to wrap this and bring it back into storing how you getting that information from Marketing Cloud and populating it back into Health Cloud. So for the alerting, the storing of the information as well as alerting. So
Sure.
I do want.
Yeah, and we'll get back to the Miro board here in just a second.
Oh, no, I just wanted to let you know that's the last piece I want to bring in, but thank you for showing this.
Yeah, no, and good on the time check too. But yeah, so I just wanted to put like kind of more of a visualization again to anybody that's not as familiar. So this should look pretty similar, right, to that white or the Miro board that we're putting together. You can see like that we have now none of these activities are defined. That's why they're in that off gray type of color, but you can essentially see, just as we've been building on that Miro board, I always like to, when I'm talking about Journey Builder with customers, I call it like a whiteboard that can dance, that can actually do things. So you actually are building this and it actually can, activate and engage with your different patients or HCPs. But you can see how it's really that simple to be able to build this. So you just have your entry event right here. And as Jordan had kind of highlighted, that's probably the most important piece of building any journey in Marketing Cloud, is making sure that you have the proper entry event and that data classified that you want to be able to use to meet those requirements. And then if you look and scroll down here on the left-hand side, you can see that we have, for example, like that wait until event that we've been talking about and kind of geeking out over, that you're able to use to kind of control that flow. And then we have those activities that you're able to drag and drop and put onto the canvas. So again, just trying to put a little bit more of what this actually could look like in the platform. But this is, if you're not as familiar with Journey Builder, this is essentially what it would look like as a business user as well.
Awesome. So and I think it's really vital is that if you're a business analyst or if you're a solution architect, you are whiteboarding what Jordan was taking us through, and then Marketing Cloud, this is what it's going to look like in Marketing Cloud. But you're going to whiteboard it first. You're going to work with your clinical team. You're going to whiteboard this. And then this is where you're going to actually do this. And then you can do all your testing and everything with that.
A lot of lucid charts and Miros for sure in my day within Marketing Cloud. But anyways, okay, I'll throw it back, Jordan, you can pull up the Miro board and we can kind of.
No, that was a perfect tie-in. No, because I think sometimes it's like, okay, we're looking at a diagram, but really the correlation is, no, that is literally what it looks like in Marketing Cloud. Almost really like the Miro board, right? So wait, let me make sure I'm sharing the right one. There we go. Okay. Marlene,
Yeah,
are you still raising your hand or did you forget to take it down?
I didn't know that you had to take it down. So yeah, no, I'm not. See, you know what it is? I'm so Google used to. Zoom, I got to get back and practice with.
I get you. I have 3, Zoom, Google, and Teams. Go
Yeah.
ahead, Jordan.
all good. I was going to say, just as my own anecdotal, I guess, evidence that going through the process in Miro or something like Lucid Spark or Lucid Charts, et cetera, prior to getting into Marketing Cloud helps to facilitate not only because the collaboration is easier and have multiple people on the same board at the same time, but you will find much quicker, in my experience, some of the additional things that you might not have at the surface. So for instance, the fact that we decided to change our message flow to have the third one first becomes much easier just to complete that in an exercise in something like Miro prior to getting to Marketing Cloud. But obviously you can do that in Marketing Cloud if you feel comfortable doing so. So anecdotal evidence aside, I know that we wanted to talk a little bit about how do we get those responses back into Health Cloud if they're happening in Marketing Cloud. So a couple different ways here, and CJ, I'll defer if you have an opinion one way or the other, but when you implement Marketing Cloud Connect, which is, I'll try not to go too technical here, but it's a managed package that you install on top of Health Cloud that allows you to designate which objects and records get synced to Marketing Cloud. And as a part of installing that package, you also get a few different activities in the Canvas area that CJ was showing that are specific to CRM. And thank you for moving over. I'm actually going to create a couple of additional ones here because they're not here right now. So I'm going to create just 2 over here, 2 new ones. And we're going to color code these as blue because that's what color they are in Marketing Cloud. We're going to call this update contact, and we're going to call this custom object. And I'll explain what that means here in a second. So a couple of different things that we can do is if we want to create a record back in a core CRM environment that we know is connected to Marketing Cloud, one really easy way to do that from Journey Builder is to use something like a custom object update or a creation activity. And effectively, when you go to create this, you will say, create, let's call this an interaction record related to the patient and the encounter. And so we can pass different values in. Maybe we have, I'm going to make this up, might not be pretty. That's the beautiful thing about doing this live. But let's say we have information related to the message sent, the response received, time sent, etc. We can take all of these attributes and include it as a part of the activity to create this record back in a core CRM environment. So that's one option. I say custom object because this can be done for any of the custom objects that you might have done to customize, as well as the managed package for Health Cloud objects, which are technically considered custom, even though they're relatively standard. It's a managed package. That said, the other one that probably is worth calling out is we would do this any interaction that we wanted to create. So if we wanted to do this for each SMS message, then we can do that. But we'll just say that for all intents and purposes, we only wanted to do that after this message, and then maybe after the last one. This other activity for updating the contact, let's say after they've completed this entire flow, and there can be different update contact activities depending on which subpath they go through. But if they have gone through, they said that they're feeling either better or worse, but it's not an emergency. They've gotten their medication. They have their follow-up appointment scheduled. Maybe at this point in time, we're okay with saying, for the encounter, the discharge follow-up is completed. We're updating that status. And then maybe for the contact, we're going to say update contact. And I'm going to move this underneath so it's easier to read. And we're going to say update risk status normal instead of elevated. If we had that previous value is elevated, given the elevated risk of 72 hours after discharge. And this will go in on the contact record and actually update that value based off of whatever business rules or clinical rules that we wanted to employ. So let me pause there and ask if there are any questions. Does that make sense Is that answering some of the easier ways to get data back from Marketing Cloud into Health Cloud? Do we want to go deeper on that?
Looks like we got a comment that said it does make sense.
No, so far everyone's being really quiet other than really appreciating it. So that's better than there's been no hate comments, but it seems like everyone's just still absorbing.
It's a lot
That's
of
fair.
information.
It is a lot. It's a lot, and it's a blessing and a curse, the different directions you can go, because you have to kind of balance the pros and cons without doing it's a lot to accomplish in 1 hour. So I think that we're doing a great job on it, though.
You guys are rocking it. So deeply appreciate you guys are rocking it. So where'd you go?
I'm just reviewing the goals, the requirements, and the assumptions, and I think that we have most of the puzzle pieces identified here. One thing that we said we were going to come back to is if the time since the last encounter was less than 30 days. So I'm actually going to ask CJ, do you have an opinion on the best way to accommodate that? Is that like a decision split that we would want to reference and then look at the contact model? Or would we want to reference that in a different way?
No, I think I would typically use a decision split and the contact model. And I mean, we don't have enough time to get into the nitty gritty there, but there are definitely a lot of considerations, as I'm sure you know, Jordan, on making sure that that data is linked correctly in the contact model to be able to be used. But that's typically what I would use.
Okay. If there are any questions on that from anyone on the call or anyone watching this in the future, feel free to reach out or ask a question in the community group, and we can talk about that in more detail. Basically, the requirement is actually looking across all other encounters and checking if that's happened in the last 30 days. And that's usually best suited by having a contact model configured so that you can reference all of the different records that are associated with a single person. So
one thing I'll highlight too, Jordan, that we get questions on all the time is you'll hear this concept of journey data and contact data, right? And journey data is the best way to think about it is you've got a backpack and everything that's in that backpack when you come into the journey, that's it. That's essentially data that comes in. It doesn't change. It's just the data that you had whenever you put it into that backpack, or it's basically a snapshot of the data that comes in on a contact when they enter the journey. The contact level data, that's like the data that's essentially the most up to date. That's the data that's living. That's the data that could be changing as somebody goes throughout a journey. So if you want to be able to, like within this case, look to if there was a new record or if there was a new piece of data that has come in since that person has entered the journey, you'll always want to use contact data for that. But if you really just need to know data that they had when they actually entered the journey, you can just use journey data for that.
Oh, so then basically if they end up in that scenario, and again, I can't raise my hand, so I'm gonna be rude, but basically in that scenario, if they go to be reached out to and you're waiting for them to respond and they could have already been readmitted back into the hospital, you don't want to send them a text message saying, so feeling better? They're gonna be from the ER going, no.
Yeah. That's a perfect example of when it's really important to make a decision between journey data and contact data. I'll say, and CJ, I'm curious of your experience. I personally prefer contact data because the most up-to-date information is always going to provide the best experience, in my opinion. But there are some use cases where journey data is actually better. So.
Yeah, I'd say in my experience when building journeys, I always actually, I stick default to journey data until I need the contact data. And then from there, and what I mean by that is you may have, especially at the beginning of the journey, you want to do some types of segmentation before you send that first email. Journey data is totally fine to be able to use for that. So if you have like a predefined, maybe it's like an event invitation or something like that, I would always start with journey data. And then if you have that use case does require some sort of, like as you admit, I think you mentioned there, Tina, that you want to make sure you reference so you stop communicating or put them on a different path, then at that point, start using contact data for really any of those decision splits going forward. And with the Marketing Cloud Connect package, you can set up those synchronized data extensions that are automatically mapped in that contact model that should be updating as quick as every 15 minutes. So if you have a new record, you should be able to unless they reach that step before, and then there's a new record within the next like 15 minutes, you should be covered.
That's a
Perfect.
good call out. Marlene is asking for a general ROM. I'm assuming, so Marlene, come off mute for real quick. Are you talking about like a consultant trying to give a ballpark, like you're trying to pitch this to
Yeah,
someone?
like let's say we're moving along, we're just towards the end of discovery and we share this with them, they find out and they're like, you know, that would be great. Let's do this. So we refine it. How much more is that going to add?
Wait, but is it the discovery to whiteboard it out or the marketing cloud to build and test? That's
Both,
really
if you could tell me, but actually at the end when it gets to the build and test.
right. So like that journey. So I just need to bumper it because, you know, we all know in the consulting world how this is so broad. So CJ, for the marketing cloud journey that you displayed, what would say your level of effort with that?
Just a, yeah, general idea.
Yeah, well, I will say in typical solution speak, it depends, right?
Mhm.
So it really does depend on how, you know, that particular client of yours has their data already structured. And if they already have a good, like, you may come in and they may not have Marketing Cloud Connect already configured. So obviously that's something as a prerequisite that you'll need to do. So, you know, in terms of like actually building the journey, you can theoretically build a journey with at least the messaging capabilities within, you know, minutes. I mean, SMS messages are very quick to put together. I will say, you know, building the journey will take you much less time than actually testing it because as I'm sure you're familiar with, Jordan, like contact data can be a little funky sometimes in terms of how you want to make sure that specific person goes down. And you know, if you have a requirement from the client for QA to make sure you test through each type of route or option, then that could be fairly significant given the number of decision splits. So, and again, that's something that with the synchronized data extensions for sure, you know, after you do a test, you kind of have to wait for that data to sync over. And depending on the volume of data, that can also kind of play into the amount of time you spend. So in terms of building the journey, it shouldn't take you long at all. You can really build it within you know, minutes to an hour per se, but the actual testing part is where you're going to really want to make sure that you have enough time budgeted to test that. And the more decision splits that you have using contact data, factor that in, is that's going to be more time for testing and QA.
Right. Okay. Yeah, good clarification. Just, yeah, you know, you can always be stuck in discovery forever, but for sure this makes sense.
All right, we are coming up on the hour. CJ, Jordan, both of you, thank you so much. I have a feeling that our normally very much more lively group was just overwhelmed, but this was a lot. And we had a lot of people sign up and a lot of people are asking for the video, the recording. So don't be surprised if questions bubble up later because your expertise in what you presented on was awesome. And there's a huge need, as you guys see that, right? Jordan, I know you're seeing that. CJ, you're seeing the request. Corinne and I are familiar with that as well. So thank you so much for your time and sharing of your wisdom and experience. I deeply appreciate it. I know, Corinne, you appreciate it. And to be respectful, we are at the top of the hour. And we have a new voice chiming in and how much they appreciate it. So I think you guys wowed them. So good job on that. And everyone, we will post when we end up sharing the video. And you all have a fantastic night. And thank you so much.
Thank you.
Awesome.
Thanks all.
Thanks.
Bye-bye.
Have a good one.
See you, everybody.